Hello, I'm Dr. Thomas Serena, CEO and founder of the Serena Group family of wound and hyperbaric centers and the director of the Serena Group Research Foundation. I'm a general surgeon by training and still boarded in general surgery, but my entire practice now focuses on patients who suffer from acute and chronic wounds. I'm a woundologist. One of the wounds that we see quite frequently are venous leg ulcers. They're caused by venous insufficiency in the lower extremity. Interestingly enough, this is the most common disease in the world. Venous insufficiency is extraordinarily common, not just in the US, but everywhere. Advanced venous insufficiency leads to the development of ulcerations in the lower extremity. Another problem that we see in the wound clinics and lymphedema centers across the United States and the world is lymphedema. And it's an orphan. And what do I mean by that? What I mean is that it's generally taken care of by physical therapists, and they do a fabulous job, but it's not well reimbursed, and it hasn't gained a lot of acceptance in mainstream medicine throughout the world. We have two big problems that you may not have heard about. Painful, open, draining venous leg ulcers that occur in 7 to 8 million Americans, and lymphedema, a problem that afflicts millions of individuals across the world. What's the solution to this? Well, right now what we do is compressive therapy. And for lymphedema, it's very labor intensive. We have a variety of different pumps that can be used, manual lymph drainage, which works very well, and then compression wrapping. And for venous ulcers, we use multi-layer compression. It's our standard. And then after you use multi-layer compression and heal up the ulcer, we have to use stockings. Well, try to get one of those stockings on every morning. We did a quick study, and we found that patients in our wound centers that were over the age of 80 could not even don one of those stockings. It's a big problem. It needs solutions. And I've been working with Elastomend now for the last couple of years, and we have a novel device that provides the compression that you need without the compression wrap. Now, if you haven't seen a compression wrap or don't know what I mean by that, you wear a compression wrap, multi-layer compression wrap, for a week at a time. And once in a while, we'll have patients come in twice a week if it's hot or if it's draining or something of that nature. But for the most part, it's a weekly dressing change, and it's hot and it can be uncomfortable. We're looking for solutions that allow us to have the patient have a device that they can put on and take off, and that's what we have with the Elastomend device. In addition, it's not just for venous leg ulcer disease, it is also for lymphedema. So we have an option, and I would suggest that you have a look at the Elastomend device. I'm very bullish on it, and if you have questions, please feel free to contact me. Again, I'm Dr. Thomas Serena. Thank you.